So this is the fourth of the EFID series of webinar, and today we will talk about the COVID-19 emergency, and especially the way we are coping with it and how we are organizing and adapting our work to do the best to improve the lives of people living with dementia. So before we start, let's just provide some housekeeping rules to you. You are muted by default, meaning that you cannot really speak, but you can raise and you can ask your questions anytime by using the Q&A button at the bottom of the Zoom window. Please feel free to type your questions. We will do our best to answer to your questions, and also we will have a Q&A session at the end of the webinar where you can share your experiences. I've seen that you have sent many emails in the EFID mailing list to let us know how you are handling the situation. So it will be very nice if we have time to also open it up to you directly and to share your work and how you adapt your work to cope with the coronavirus outbreak. You can also use the chat if you want to address the panelists directly, but for your questions, I really advise you to use the Q&A button. In case you have a very compelling remark to make, you can also raise your hand. There is also an icon with a hand at the bottom. You can click on that and I will do my best to give you the floor. The time is really tight. Today we have 1 hour and we have a number of interesting presentations to hear. So I'm not gonna waste more time and I start immediately. Let me just share the agenda for today. So today we will start with a very spontaneous and informal conversation with 3 organizations. Novilunio from Italy. Novilunio is part of the EFID awardees, so some of you might know Novilunio and Christian already. Christian is founder and president of Novilunio, a not-for-profit organization working on peer support groups, involved in a number of EU-funded projects, and also recently they have started a new project on counseling for couples from the diagnosis of dementia onwards. But we will hear more from Christian in a moment. Then we have the Empowerment Network. This is a new network, well, new to the EFID circle, I would say. It's for German-speaking countries, and it's a self-help group network led by Peter Wiesmann from Dementia Support Stuttgart and Christina Pletzner from Austria. Last but not least, in this panel conversation, we have Delta 7, an organization from France, from Paris and the suburbs. This organization is also new into brackets to the EFID network, but it has been awarded very recently a prize from the Fondation Médéric Alzheimer in France for the way they are managing the COVID-19 emergency and how they have adapted their work of a daycare center in an online and virtual space. And Cedric will tell us more about that in a minute. Cedric Cheng is a space and nuclear engineer, but he has been director of hospitals for 10 years, and he is currently the manager of Delta 7. Then we move to the talents of Astrid Stockman and Lisbeth De Vos, 2 opera singers from Belgium. They have started a project called Stockman and Vos. And if the technology is with us today, we will also get the chance to hear them performing at the end of the webinar. Last but not least, we have Diane Gouve from Alzheimer Europe. She's director for projects, and Diane will share with us the recommendations on COVID-19 and dementia that Alzheimer Europe drafted together with the Alzheimer associations in Europe and the government as well. And then we have space for some sharing and learning and Q&A, hopefully. But so let's start with the conversation and the panel with Christian, Peter, Christina, and Cedric. Just the last technical point. The webinar is recorded, so just for information, and it will be available on the EFID website, so that people can watch it again, or people who couldn't join us today can watch it later on. So Peter and Christina would like to start. The floor is yours.
Okay. Shall I tell something about the empowerment?
Yeah,
network?
maybe we can. You can also start with saying how your work has evolved, how self-help groups and peer support groups, and maybe you can also, yeah, quickly outline the difference and tell us what's the difference between the two wording, and how your work has evolved in this digital and online situation.
Okay, so we can start what empowerment is.
Mm-hmm.
All right?
Yeah.
Christina.
Okay, so empowerment is a network of supported self-help groups for people with forgetfulness, memory problems, also with dementia. It was founded in 2019, so it's a really new network. We started together in Stuttgart. And the members are self-help groups from 3 different countries. It's included Austria, Germany, and Switzerland. And what is our goal? And the goal of this network is the first point, to create more of self-help groups for people with forgetfulness or memory problems, as there are only a few in the German-speaking countries. There are many groups for carers, but especially for people with forgetfulness, there are only a few. Yeah. So that is one of the main goals, but also to enable exchange and to learn from each other's experiences. The group discussion is very important, to learn from each other. Also to strengthen the consciousness of the power of self-support for people with dementia. Because we always say, if one person with dementia is speaking, that's good, but if it's a group, it's better. And if it's a network, it's the best, because we have more power together. So we want in our network also people with memory problems, because their active contribution is very profitable for us, because we want to know the viewpoint of people with dementia, and they are also members of our network empowerment. So that's just a few points to the network.
So you could show the little slide we have prepared.
Mm-hmm.
All right. One moment. Okay, you can see it? Yes, it works. It works. All right. Okay, you start with the first point.
Okay, so people with memory problems, dementia diagnosis not necessarily needed, stands on the first point. And this means that the participation is open to everyone who has problems with the memory. It doesn't need to be, it's not necessary to have a dementia diagnosis. But what is important is that the people acknowledge their situation, and they are also willing to talk about their situation, because there are really a lot of people who doesn't have dementia, and they are not willing to have this diagnosis, but they are struggling in their lives and they have nobody to talk about. So that's also one important point.
Second point, I think most people don't believe that people with dementia or with forgetfulness can reflect their own situation. That's a lie. There are a lot of people with forgetfulness can do it. They have self-help skills. That's the second point.
Mm-hmm. And as we know, there are many groups for people with dementia, for example, therapeutic groups or education groups, leisure groups, and so on. But supported self-help groups for people with dementia, there are only a few. And the focus of these groups are dealing with their situation.
Yes. And so we say in these groups, there are only people with memory problems. Relatives are not allowed. They can't participate on these groups. It's very, very important because we need a space to speak free. And that's only possible when people who are affected by dementia or other cognitive impairments are only in this group. That's very important for us. And we tell it so to the relatives and other persons.
Mm-hmm. And usually in dementia activities, there is one person who decides what is happening. But the difference here in the self-help group is that the people by themselves decide what they want to talk about. It's not, and the assistant is in the background and he is doing the framework and everything. But the topic is decided by the people themselves.
And we talk about people with cognitive impairments, and there is it that they need support by other persons, most professional persons. But what is very important, this is not about care, it's about assistance. The moderators, the other persons are something like butlers who help that the people with impairments can realize their things. That's very important. And it sounds very easy, but it's not easy in the reality. We know in the practice, no, it's not easy. This consciousness that it's about assistance and not care.
Mm.
And maybe let me, Peter, indeed, it's not easy. And let me call here Christian from Novilunio, because they are, in fact, running peer support groups online even before the corona outbreak, so they are somehow used to it. And I'm curious to hear from Christian how your work has evolved since the corona outbreak, since your work was already online. Christian.
Yeah, thank you, and hello everybody. Some of you already know me, and Eloisa from Novilunio, and that she's here with the spirit, but not only with the spirit. And just to introduce, Novilunio was created in 2014, and our idea was really trying to inspire cultural change in the world of dementia. So we met a lot of people with dementia. We spoke a lot with them, and we share a lot of stigma, problems, meanings, words. We listen, and we are listening a lot from people with dementia because we are really learning a lot from them. And we started with a peer support group online. That was also our kind of award with the EFID 3 years ago, trying to put together people with dementia and that they talk online. And even if the COVID just infect lots of different activities, we had the opportunity during this period also to consolidate another kind of peer support group that is not only for carers, not only for people with dementia, but is for couples. So that's our new things about Novilunio in the last 3 or 4 months. That is quite important for us because we arrived at the solution that targeting specific group that they have no help from a health system, from the social system, etc. As for example, the young onset dementia, we found a hole in this world. There is nobody following people that are young, that are still working, that they have kids, that they are a role in a family, and that they are struggling with everything. So our idea is okay. We are talking with people with dementia, but we have to target the family, the complex system that is a family without a person, a partner with a role, without maybe the job, without this specific role as a father or as a mother in a family. And that's why we created this. During the COVID, was quite difficult to recruit people, because everybody was in the home. They were some kind of recreating and a kind of, or they were like doing that. That means that, okay, before COVID, that there were work, job, kids going to school, everything was normal. And during the COVID, everybody was at home, and they were dealing with the different kind of roles and different kind of routines, and everything was changed. So the first thing that we saw during this period was that the people were adjusting to stay at home and to kind of change their life, their way of life, without any kind of health service or social service, and quite alone and abandoned. And so that's what we found in this period, and that's why this kind of support pathway for couples, we created this kind of place where there is a psychological support with a specific psychotherapists, and then also a kind of a peer support group with only a facilitator, and that, you know, Eloisa, and then we have a social worker and other people that are working on it, and but two different things. So the idea is to give them the possibility to have an individual support from a psychological point of view, and a group support for peer support group or psychological support. So the COVID for sure gave us the opportunity to understand that the family, the nucleus, where the people lives, are very important, and you have in some way to speak with all of them, even if differently, in two different parallel ways, but to have both of them in the boat. And so that's what we are working now, and also kind of with other projects that are different, but right by now I can tell this, and that's why we think that this I put also in the slide the co-creation, because we asked also them, what do you expect from us? What do you need as a carer or as a person with dementia? What do you think is important in this moment for your family, for where you live, for your home? And that means that there are involved also kids, 9, 10, 12 years old kids. We're not talking about adults. So everybody are involved in this kind of support pathway. I just stop now and then.
Thank you, Christian. Thank you. And you also mentioned before the recruitment of people for your groups. And maybe I would like to ask this question to Cedric. We can start with Cedric so that he can also introduce his project, his organization. And Cedric, so how do you reach out to people living with dementia?
Okay, hi everybody. In France it's very easy because there is a kind of pathway which leads people from home to hospital, memory places, specific services for memory, and then it leads to them to go when it's time for them in our care centers. So recruitment is not a problem, and it's just like a pathway people are following. And so I can maybe introduce the project we had. So my name is Cedric Chang from France, and I'm manager of Delta 7, which is a non-profit organization, which was founded in 1973. So it's almost 50 years old. And we have 3 expertises. We are experts for helping the elderly to have a well-being even with the age through exercises, activities, programs. The other expertise is about helping people with dementia or just memory troubles, and also their carers and the family And the third expertise we have, it's about helping the elderly with practicing digital practice, in fact. And we train people using iPads. So Delta 7 own like hundreds of iPads that we can give to people to train them. So it's for the elderly specifically. And also we have special program to train people with dementia or memory troubles on the digital practice. And so we manage 4 centers, 4 care centers in Paris and suburb of Paris region for people with memory troubles and dementia, especially Alzheimer's disease. So when COVID arrived, the minister, French health minister, decided to stop the activity of the care centers all over France. So we had to stop our activity of our 4 care centers, and it was very difficult for our teams to think about our patients alone at home or just staying at home with their carers. So we decided to replicate the care center routine, everyday care center routine, but online. So we created the project Casa Online. Casa because it's the name of our care centers. Our care centers are named Casa Delta 7. Casa Delta 7. So it's named Casa Online for this care center online. So every day so first Delta 7 has got a web TV which is called Canal Delta 7. So this web TV is producing videos about autonomy. And during the COVID, we decided to take all the material from the studio to make like small kits with mics, lightnings, and cameras, tripods. Well, all we need to make videos, and we send it in the different homes of our teams. So our different professionals, they were able to produce their own video, to record themselves producing exercises, activities. And so we could place all those videos on our web TV. So it was a great opportunity for us to share largely our production, not only in Paris and for our centers, but because we are a non-profit organization, we decided that all the videos of the activities we produced was online and with full access for everybody. So it was a great success. Right now we measured like 20,000 users for our videos all over the world. So with 6% of international users, especially in Belgium and Quebec, which are French speaking, because it's French videos. So you have to know how to speak French. It's better. And so 40% of the users are from Paris region, and 50%, well, around 50% for all over France, not in Paris region. So it's very interesting to see that it's quite a new approach because we all know about care at home, with people going at home for taking care, to deliver the caring action, to deliver the cure action. But with the Casa Online, it's slightly different because there is nobody at home. It's only delivering the care and the cure through the network, the internet. So we don't know really what is the impact. Is there a real therapeutic impact? We have now to analyze because we collected thousands of data during the COVID. So now we are with East Paris of University, well, preparing a great analysis of the data we collected to know if there was a therapeutic impact. At least it's a great opportunity to make people well, exercises their memories, with physical activities, and so it's very good also about loneliness when you can see the face of the people you can meet in the care center when you are not in COVID period. The first videos we made, it was like a test. We did something by ourselves, and then we were asking the people with dementia, with memory troubles. We were asking also the carers to know, well, did you like it? What you want now? Oh, yes, you like activities with paintings, for example. So, okay, we produce new activities around paintings. What do you like? You like meditation? Okay, so meditation was a new approach we had. It was the first time we delivered some meditation. And because you like it, now we will change our program. And even when you'll come back in the care center, we'll change also our program to introduce some meditation because you liked it. So after the first week, first maybe 2 weeks or 3 weeks, it was a lot of idea from us, and more and more the people involved with us through this experimentation gave us their point of view and gave us the opportunity to make improvements in the content we produce online. So that's it.
Thank you, Cedric. It's really, really interesting, and I provided the link on the chat to everybody, so you can all have a look at the work of CASA of Delta 7, and especially the CASA online. And I've seen that you also have the Delta Lab, so it's a research and development lab that really evaluates and studies the impact of the videos that you are producing, and not only. And yeah, maybe just to conclude this panel, because we are running out of time, just a closing remark by Christian and Peter, maybe on the recruitment, on how you reach out to people living with dementia, and on how you evaluate. But very briefly, please. Peter.
Yeah, so it was also a question in the chat that how to recruit people.
Yeah.
And yeah, it's true. It's not easy to recruit people with dementia without the carers. How is it possible? So what we did is, it's very important which language you use, for example, for the media, and that you don't say that's a group for people with dementia, because people with dementia, most of them, they don't want to have this stigma and they would not come. So we used another language. We said these groups are for people with memory problems, for people with forgetfulness. The diagnosis is not necessarily needed, but if you have it, you are also invited to come to the group. And we also talked to different interfaces. For example, we went to memory clinics, we went to doctors. We also advice centers or people where seniors are active. And we said to them, it's a nice group. We come together, we talk about the problems that you have with the forgetfulness, but not only that, it's also a nice coming together. It's about humor, it's about laughing, it's also about talking about different things, so that they have this feeling, okay, I am not a victim. If I go there, I feel stupid or something like that. And also for the carers, we told, excuse me.
Oh.
Do you still see us?
Yes, we can still hear you.
I'm sorry. The carers, we tell them that if they are in the group, it changes the group dynamic.
Dynamics.
So,
Yeah.
and they accept it, and they
Okay.
will come.
Thank you. And for you,
We work
Chris?
together.
Sorry.
We work
Yes.
together with relatives. It's
Yeah.
not possible without them. But it's another thing that we don't say the group is only for the affected people. That's another thing.
Yeah, sure. And in your case, Christian, also the fact of being online, does it has an impact?
To be very briefly, we have. I'm lucky because Eloisa is writing a very good blog with a kind of web library about intervention, human rights.
Please share the link on the chat. Where is it?
Yeah,
share
it's
the link.
our
Yeah.
website. I will share it.
Yeah.
And I think that that's our recruitment point, because people just reading from different kind of, we have over 200 articles now, and we also subtitle testimonials, also lots of people from the Irish working group, or the lots of people that we met also during the EFID meeting are part of our website, and testimonials, and saying that you can do that. And so people that are looking for information in the website, especially in Italian, we are like very high in the Google search, because we are touching different kind of argumentations, especially that are not touched from lots of people in Italy. So that's how we are recruiting.
Thank you.
They call, and
thanks
to the blog.
Thank you. And yeah, thanks, Eloisa. Okay, now she's sharing the link to the blog. Okay, I think this conversation was really insightful. Thank you so much for sharing all the information. And maybe I would like to conclude this with a comment. I see that Helen raised her hand, and I think it's a very good way to conclude this conversation and pass to the next panel. Helen, I will give you the floor so that you can ask your question or...
It would help if I
Yes. Hi, Helen.
Hi. Hi, everybody. Thanks, Kristen, Christina, Peter, and Cedric. I was just curious to know how you reach out to people that cannot use technology. I'm concerned about people being left behind, and to Cedric in particular, I just wondered. I love, by the way, I love all your work and being so innovative, all of you, and thank you for what you do. I just wondered, when people received a video and if they lived alone, how did they get support to use the technology that has been sent to them?
Yes, that's a very good question. So Delta 7 is very specialized for training people with using this digital practice with iPads, and we can give them our own iPads, which are managed by Delta 7, and with only one click, so it works like a TV, in fact. When we give to them our iPad, they just have to click on the small logo we show to them, and it's like TV, it's on off, and they are immediately on the good page, good URL, good website. So for the other people, yes, it means they need to have internet, they need to have equipment, they need to have somebody sometime to help. But for the carer, because our Casa Online was used in different institutions, but also at home, people send us mails. So sometimes the carer can turn on the equipment, and so then the patient can look at the videos. But that's true, that's totally true. We cannot use it for everybody all over the world right now. But what is sure is that our tablets, our iPads are settled in order to make it easy and possible. So now, for example, there is a part of Paris region. They ask us to supply hundreds of our iPads managed Delta 7 way in order to help people with dementia or with a low capacity to use internet or technology, to have the access. So I think the question you ask is very good, and we need the help of institutions, of politics, to give the access. That's another point. But it's something more. We can't have only through videos. Videos is something more, something complementary.
Thank you. Thank you so much, Cedric. Totally agree. I realize that time is really running so quickly. So I would like to give the floor to Astrid and Lisbeth. So two opera singers from Belgium to present their project on how to stimulate elderly nursing homes and how to use music as a powerful tool to stimulate them. Astrid, Lisbeth.
Hi.
The floor is yours.
Okay, I will start.
Sure.
Yeah, my name is Astrid, and together with my colleague Lisbeth, who will talk later, we have a project that we made ourselves. Initially, we wanted to bring culture and cultural participation in the form of music to elderly in general. So we were not focusing on people with dementia. We were looking for a nice mix of classical music, which is very known by the elder public, and some local songs in the mother language who have a musical quality but speak to them, that are memories from when they were young. And we have tied it together with some humor and stories on a very adult, normal level, without trying to adapt to our public, because why should we? That was our thought when we started. And so we began with a few tryouts in the nursing home. So the goal is to go to the nursing home and bring everyone together in the hall or where they eat, and we make it into a concert room for 1 hour. And from the first tryout, we really saw, also when we spoke to the caretakers after the concert, that there was a very big reaction from people with dementia, often surprising their caretakers because they were not communicative anymore or not responding to anything on physical level or intellectual level. And there were people in the first row like a bit catatonic or not really responding. After a while, they heard a melody that was anchored in their brain very strongly, and they started singing or moving physically with their feet, with their hands, or they really opened their eyes, and it's like they come alive. It was incredible. We saw that happen, but we did not know the context of these people. So afterwards, we talked to the caretakers, and we got the information that the background of these people is that they live with dementia. So since a few years, we are building this project and trying to include the caretakers, the other residents, and the family of the people with dementia. So that's a bit our main goal. If Lisbeth wants to add something.
Yeah, no, I think that's quite it. What we actually want to we want to create a kind of concert experience, a kind of external experiences in their homes, in their safety environment, actually. So they are kind of taken away abroad, but still staying in their safe environment. And that's what we try to give with our music. We also speak to them in a very serious yet complexless language, so everybody can really uncomplicated language, so everybody can really really be there also and follow the stories. And what is nice is that we build the story in that way that people see the song coming. So it's because it's often songs of their youth. So they know certain songs that were really popular, and in the context of what we're saying, they kind of guess. So it's a very active way of performing for elderly and people, especially people with dementia. So, and we have a great time. The family has a great time. The caretakers and the people with dementia also. So that's kind of our goal, to make it very inclusive, and it works very well. For
Yes.
so
Also,
far.
during the performance, there's always a moment where we go into physical contact also with some people, in a very, very iconic song that they all know, to really make a connection through the eyes and through the body language. Now, in the COVID times, we are of course restricted from the nursing homes in Belgium, so we cannot go there. We have made a video.
Yeah, you found a very good solution, though, to still keep the good vibes. It's not the same, obviously, but yeah.
I miss the physical and the direct communication and the physical communication with the people. But
it's a good alternative. Yeah, it's a good alternative.
Yeah. Good. We will. I will try to put it on and share my screen and audio so that we can hear just a little piece of your video. But I will definitely share the link so that people can watch you and also listen to your songs even after the webinar. So, but for now, okay. Do you have any other comments to make or?
Yeah, just I wanna add to it that our goal is to adapt our program to every language. Not every. I mean, there's limits, but like in the south of Belgium, we do it in French, and we look for French popular songs from the time that those people were young. If we go to Germany, we do it with German songs. You know. We try to adapt in different languages and really feel the environment and the youth memories of that specific group of people. Yeah.
Thank you. I'm going to share the link right now, but we will hear it later on at the end of the webinar. Okay, so thank you so much, Astrid and Lisbeth. It's always nice to hear also these very good examples of keeping up the good vibes, and this is really important in such difficult times. I would like to give the floor now to Diane Gouv from Alzheimer Europe. She's director for projects, and as I mentioned at the beginning of the webinar, Alzheimer Europe has published some recommendations on COVID and dementia. So Diane, please, the floor is yours.
Okay, thank you very much. I'll just try to share the screen now.
Yes, let me know if it works or if you need help.
Blank screen so far.
Yeah, I think it's starting now.
Okay, hang on.
Yes, and you can maybe put in a full screen mode.
Okay.
Yes, thank you.
Okay, so good afternoon, ladies and gentlemen, and thank you, EFID, for having invited me to speak at this webinar. The pandemic has resulted in an upheaval in everyone's lives and a tragedy for many people. And there's a lot of discourse about COVID-19 surrounding war and the personification of the virus. But I think what's really important is this sense of unity amongst individuals and groups. Differences and competition are being put to one side, and people are demonstrating solidarity by working together with a common goal of providing necessary support and protection for people from more vulnerable groups. And my focus in this presentation will be on solidarity with and towards people with dementia. Early on in the pandemic, and in keeping with the spirit of solidarity, there were growing concerns amongst Alzheimer associations about people with dementia not receiving proper care proper intensive care, including access to ventilators, especially in situations where resources might be scarce. And we were concerned about the potential discrimination based on negative stereotypes, value judgments, and ignorance about the condition. Alzheimer Europe and its member associations organised Zoom meetings with government experts, Alzheimer associations, and people with dementia to explore ways to support people with dementia and to ensure the protection of their rights. So first, we drew up a position paper on the allocation of scarce medical resources for intensive care services, which was endorsed by 48 national Alzheimer and other European associations. And then we turned our attention to developing recommendations related to the impact of COVID-19 on the lives and well-being of people with dementia and carers, and the implications for society, which is what I'm now going to present. The recommendations were targeted at Alzheimer associations, health and social care professionals, and governments, and were designed to help promote necessary and appropriate support and to challenge discrimination and injustice towards people with dementia during the pandemic. So they're based on a consideration of the different measures which have been introduced across Europe to tackle the virus and the impact of these measures on the lives and well-being of people with dementia. And on this slide, I've summarised some of the key measures which have been implemented variably in different countries. Most are still applicable and or risk being introduced at some point. And these measures affect all members of society in some way, but the impact may be greater for some groups more than others. So isolation and distancing can mean being cut off, sometimes completely, from the outside world and from loved ones. And in many cases, for example, in care homes, being more exposed to the virus without having access to intensive care treatment, as in hospitals. People with dementia are particularly vulnerable, as they may find it more difficult to adapt to the changes resulting from the pandemic, have difficulty communicating their needs, and be unable to defend their rights, with implications in many cases for their very survival. The COVID-19 pandemic and the challenges it poses means that people with dementia may find their normal routines disrupted, feel lonely and anxious, and fear not being able to cope or being abandoned.
Diane, sorry, if you might speak a bit slower, just to allow, thank you.
Okay, so people may forget or not understand why relatives and friends are no longer visiting and why services and support are no longer available. They may become withdrawn and depressed, resulting also in self-neglect, and lack of cognitive stimulation may contribute towards a further deterioration of their condition. Sleep disturbances also and changes in behaviour may occur, and this may be difficult for some carers to manage. And even people with more advanced dementia who do not fully understand the current situation may be affected by the loss of support and sense the stress and emotional upheaval caused by COVID-19 through the people around them and also in the media. And some people with dementia may find it difficult to understand and comply with the preventive measures such as social distancing, cocooning, wearing masks, and hygiene measures, which in some countries could also result in fines. Some of the measures and the ways that they've been implemented reflect discrimination and injustice, such as priorities and restrictions on access to testing of staff and residents in care homes, people being hastily discharged from hospital into care homes to free up beds for corona patients, people being placed involuntarily in residential care homes and of being exposed there to mortal danger due to other residents and staff not having been tested, and lack of protective clothing, and also in some cases lack of opportunities for isolation and distancing. Turning to the actual recommendations, we recommended that Alzheimer associations continue where possible to support people with dementia and their informal carers wherever possible by, for example, providing information about the symptoms of COVID-19, how and where to seek help in an accessible style and format, bearing in mind that people with dementia and informal carers have different levels of education, literacy and language skills, familiarity with and access to internet, and are from different ethnic, cultural and religious backgrounds. Also to maintain contact with people with dementia and carers, for example, through telephone helplines, direct calls, Zoom and Skype to promote social contact and wherever possible, some form of face-to-face support. Also bearing in mind the point that then in certain geographical areas, in rural areas, there may be different possibilities and barriers to obtaining such support, and to provide guidance and advice to informal carers on how to support people with dementia, both practically and emotionally, and also how to look after their own needs. A key aim has been for Alzheimer associations to share information and ideas about how to provide appropriate support. The position contains examples and further information which can be found on our dedicated web page. You can see the link down there, and we're constantly updating this information. And just this morning at Alzheimer Europe's Zoom meeting with its national member associations continued to exchange on this topic and discussed relevant issues such as countries gradually coming out of lockdown. Alzheimer's societies recognise that some groups of people, which could include many people with dementia, may continue to be cocooned, emphasise the likelihood of higher and continued demand for support and of the need for greater involvement of volunteers, and the need to continuously monitor the needs of people with dementia and carers, and to make sure that this information is passed on to policymakers to ensure appropriate and fair support. For health and social care professionals, our recommendations focused on informing informal carers as far as possible and appropriate in key decision makers to help manage crisis situations, seeking novel ways to maintain contact between residents and families from a distance, not using restraint, and above all, paying particular attention to maintaining routines, providing information whilst not causing distress, and providing emotional support. We recommended that under exceptional circumstances such as emergency or end-of-life situations, limited visits from family members should be allowed only if safe for other residents and staff. We acknowledge, however, that health and social care professionals are striving to provide appropriate and timely treatment, support and care, despite fears for their own safety and that of their families, amidst low levels of staff, with increased workloads and insufficient protective clothing in many cases. Governments have an important role to play in providing the means to enable health and social care professionals to provide quality care and to ensure the safety of people with dementia in care and at home. And this brings me to the last set of recommendations. Excuse me. A key recommendation is for protective measures to be proportionate to risk and potential benefits. Some members of society should not be disproportionately burdened in relation to risk and for the benefit of others. Specialist teams should be set up to develop plans and address the needs of vulnerable groups during the pandemic to prevent the spread of the virus, guarantee access to necessary treatment and care, and to restore normal services and support post-pandemic. There should be priority testing for all health and social care staff at all levels and irrespective of employment status. All health and social care professionals should have access to suitable and adequate personal protective equipment, irrespective of whether they work for the government, for private companies or independently. And bureaucracy and unnecessary barriers which currently prevent health and social care professionals from providing essential services should be minimised. So, for example, looking at cross-border agreements and provisionally extending the residents' rights of live-in migrant carers. And then finally, governments should allocate necessary financial resources and ensure that logistics are in place so as to ensure that the rights, well-being and safety of people with dementia are guaranteed, including access to formal support during the pandemic, and that NGOs, volunteers and charities can continue providing valuable support and services. I'll just end on this slide, which is the links to some of our support. Thank you very much. And thank you also to the Alzheimer associations and experts and people with dementia who contributed to this work.
Thank you very much, Diane. Thanks a lot.
I'm gonna get some water.
No problem. Maybe, yeah, whenever you're done, you can also stop the sharing the screen. Oh, please. Thank you. This is very interesting, and we got a question. So maybe, yeah, let's open it up to the attendees to ask questions, and I would like to start with one that was typed into the Q&A function by Jan Godard from Belgium. He asks if there's a research on the relation between the type of residential care and the prevalence of COVID-19 and the quality of life during this crisis.
Sorry, I don't have the details on that. I can look into that and get back to him. I don't have that information.
Okay, maybe you can let me know, and I will share it with.
Will you be sharing? Sorry, will you be sharing the comments here in the document so that we can contact later?
Sure. Yes,
okay.
I will. I will put it there for you. Okay. But I've just seen that also Petra Rosler, she sent in links to two researches that she's compiled on COVID and dementia. So you can also find the links there. But I don't know if that answers the questions of Jan. Obviously, I didn't have the time to check on the resources yet. So is there any other question from the attendees? Please raise your hand if you want to speak. I know that there is Gabriele who requested the floor before. Gabriele, in case you are still interested in taking the floor and ask your question, please raise your hand again so that I can allow you to talk. Otherwise, I would like to briefly give back the floor to the panelists for one more comment before we move to the performance of Lisbeth and Astrid. I'm really looking forward to hear the very nice song. Just okay, another question. It's more a comment by Jan. We have the impression that small-scaled living is more appropriate. So he I guess, refers to in opposition to nursing homes. Well, we've seen also, especially in Italy, in the Lombardia region, that there has been many cases of the virus spreading in nursing home and obviously causing very tragic situations. So I guess yes, Jan, indeed. So a closing remark from all of the panelists before we move to the YouTube link. Who wants to start? Peter, Christina, or Christian, Cedric? Would you like to close?
I can start. It's not
Christian,
just,
yes.
Just also answering to Helen again that I think that as Novilunia, but as an association, I think it's really important to improve digital literacy, because there are lots of stuff going on digital, and as Cedric was saying before, and they are working on it, also teaching how to use technology. We are having also a project in Novilunio with a group of people live, not online, this one. But because I think it's a kind of a future if we want also to involve all the people that are not able or not connected or are not digital. And so it's quite important to give the possibility also to have all these materials and to take care of all the things that are going on online. Thank you, Helen.
Thank you. Thank you, Christian. Peter, Christina, a final remark.
It was fine to see that people with dementia or forgetfulness can learn to use technology like video telephony, and we will continue with this medium. And so two members of Empowerments have written a sheet, handout for video telephony in self-help groups. It's in German, not in English, but we can send the link, all right?
Thank you, thanks. Cedric, for you, there is also a question for you from Tanya.
Okay, well, we we have contact with France Alzheimer, but not with departmental associations. France Alzheimer has its own organization, so we can help any. It's not depending on France Alzheimer. It's anyone can contact us and have some help. For example, with a digital practice for the elderly or people with dementia, if they have any technical problem. In last year, we trained 3,000 people using an iPad, and so it represents like 70,000 hours of training. And we have on our tablets that we give to the people a phone number, and this phone number is with a direct contact with people, trainers who knows about what is difficult for the elderly with practicing with digital. So it could be a way to help people with technical problem. This hotline we have created with trainers, but it's not open to all the population. It's only for people with our iPads.
Okay. And there is no way to share it?
Sorry?
There is no way to share it outside?
It's difficult because if we open it, we'll have too much phone numbers.
Yeah. Okay. Thank you. Thank you. Diane.
Yeah, just to say that I really do feel inspired by the spirit of solidarity, and this is very much witnessed by the speeches today. I think that there's a lot of novel approaches out there, a lot of inventiveness and creativity that can be very beneficial to people with dementia and carers at this time and in general. And I'd just like to encourage anybody, if they have information or news about different resources, to share them with Alzheimer Europe. And we'd like to continue this spirit of sharing and learning from one another during this difficult time.
Thank you, Diane. Indeed, it's very important to join forces especially in these difficult times. There is also a comment for Jan Godard from Molly, who says that here in Italy, people are finally talking more widely about small-scale living and deinstitutionalization. So just to comment on Jan's question. And finally, to Astrid and Lisbeth, before we dive into the flow of your music, a final remark.
No, I think I think the music will speak for itself.
Yes.
And I'm very happy that that so many people on so many levels are thinking about how we can make lives better, lives of everybody, lives of people that forget things and life of people that don't forget things. I think the future is ours, and it can only be better.
Thank you. Thanks. And I guess Astrid shares your view, right, Astrid? Good. Okay, so I will try to share my screen and especially the audio to hear a wonderful song. And but in the meantime, I would like to thank you all for your participation and your great contribution in this webinar, and also to all the attendees who are here with us and who also share their questions. So now I hope technology will assist me. Maybe the video will not be so will not be optimal, but what is more important is the audio.
Je vois des gens courber le dos, comme si la vie marquait zéro. Moi j'ai 15 ans et je te dis, wow, wow, j'aime la vie. J'aime la vie, toute la vie. Il faut y croire et moi aussi. mitigé le cafard. Moi je suis rien qu'une poussière dans cet univers. Ni dès que tu m'aimes, dès que tu souris, mes joies s'enchaînent à l'infini. Y'a plus de rêve, plus de mots à ma vie redémarre. J'aime, j'aime la vie. J'aime, j'aime la vie. J'aime, j'aime la vie. Ne m'en veuillez pas, je suis née comme ça. J'aime, j'aime la vie. Tant pis si peu fait pour moi. J'aime, j'aime la vie. Même si c'est une folie, j'aime, j'aime la vie. Bravo pour le défi, j'aime, j'aime la vie. Je suis née comme ça. J'aime, j'aime la vie. Mais tant pis si peu fait pour moi. Oh, la vie, oui, tu es là. S'il y a une femme qui a eu 10 complications.
Thank you. That's really powerful. I think I will keep on watching the video for the entire afternoon. It gives so much joy, and I think it's really helpful in this situation. So thank you again to all the panelists and to all the attendees, and see you next time. Bye.
Bye.
Thank you. Bye.
Thank you, Luisa. Bye.
Bye
Luisa.
bye.
Thank you, EFID.
Thank you.